Hi, everybody. It's Linda Fostek, the crisis planner here with your Tuesday tip around the house. And as we know, emergencies come in many shapes and sizes, and sometimes those emergencies are medical emergencies. And knowing what to do in a medical emergency is very important for protecting yourself, your family, your friends, and other loved ones. So actually, last Saturday, I spent 5 hours with a Red Cross trainer getting my first aid and CPR and AED certificates. You know, it's important that you get those certificates so that you know exactly what to do and how to properly help people should they need assistance in a medical emergency. Now, first aid, CPR, and use of an AED is no substitute for professional medical attention, but you certainly can keep a patient alive, stabilize them until professional medical attention can get there. And that is what the whole concept of being certified in first aid and CPR is all about. I was very interested to see some changes had occurred in the use of CPR. We trained on infants, children, and adults. And one of the big changes is that it's no longer 2 breaths, 20 compressions, 2 breaths, 20 compressions. One of the major changes is that it's 2 breaths to clear the airway. And once you know that the airway is cleared, you start compressions and you do compressions and continue compressions until professional medical help arrives. The use of AEDs has really dramatically changed the survival of patients who are having a cardiac episode. Frequently, a cardiac episode involves an irregular heart arrhythmia. And what the use of these external defibrillators does is it stops the heart, which stops the arrhythmia, and then it allows the heart to restart with a normal rhythm so that the patient will no longer be in that state of arrhythmia. And many states have mandated that these AEDs be available at restaurants. All children's sporting events in New York mandate that they have an AED available, not just for the children that are there, because a child can have a cardiac event, but certainly for the parents and fans in the stands. A cardiac event can happen at any time to anyone. So these AEDs are truly life-saving, as is the technique of CPR. Another life-saving technique that many people use is to relieve choking. Choking, again, can happen in many locations, and unfortunately, choking victims frequently will excuse themselves and go to the restroom where they will expire because there's nobody there to help them. So if you recognize that someone is choking, it's important to ask their permission to assist them and relieve, and help get the obstruction out of their throat using proper technique. In fact, my husband was very good at that. He actually assisted 3 choking victims, 2 in restaurants and 1 that was picnicking on the side of the road when we were walking up to Neuschwanstein in Germany. A little boy was choking on a hot dog, and he, in one popped that hot dog out of the kid's throat, and before the family even recognized that the child was in trouble. So literally, you can assist and help people very easily. Another thing that with the increase in allergies and food sensitivities, the use of an EpiPen is also part of the training and how to use it properly and and why you would use it. I know my sister-in-law actually rescued her little chihuahua from a bee's nest and ended up with over 20 stings herself, which ended her in the hospital for over a week with anaphylaxis and breathing difficulties and all kinds of things like that. So allergies and knowing what to do with an EpiPen. If you know somebody that does have an allergy, be aware that, do they have an EpiPen? Where is it? Who has access to it? Do they know how to use it? And anytime you use any of these techniques, it is important that the patient go to the emergency room and be seen by a physician, because even though they think they're feeling fine, they still need to be evaluated by a physician, because these are, they've had a major event. An EpiPen is a powerful medication and should not be used and taken lightly. they must be seen by medical personnel after you use that. And then basic first aid, knowing what to do, for a burn, for bleeding, for somebody with heat stroke, and the basics, of what to do and understanding what to do. That's what first aid is all about. So invest in 5 hours of your time, get your certificates so that you know what to do when a medical emergency is faced by one of your loved ones. Go to thecrisisplanner.com for more information, and I look forward to seeing you again next week with the next Tuesday's tip. In the meantime, have a wonderful week, and we'll talk to everybody soon. Bye.